Hi, and good day to you. This is Michael Hoxton from HoxtonHealth.com. Today I'd like to share with you a little case study I just experienced this morning. And this is another example of how the spiritual issues in a person's lives can manifest in a physical manner, such as with physical symptoms of pain or discomfort. And this is a client I've been working with for under a year or so. And her main complaints, or one of her main complaints physically, was left-sided pain throughout the left side of her body, hip, lower back, the knee, the neck, etc., the shoulder, the arm, just the whole left side. Now here's a little clinical pearl. Anytime you have a client or a patient that comes to you and all their symptoms are mostly on one side of the body, there's usually, in my experience, there's a deeper seated spiritual issue going on that hasn't been addressed. So going back to this client, today we had more of a movement session, and what we discovered was that her left hip extensors, the gluteal muscles, the hip extensors, they were deconditioned to the point where she exhibits more of a knee-dominant movement strategy when she does bending activities, bending, squatting, any movement activities basically. She uses her knees more than her hips, which is very common, fairly common in most people. Hips are bigger joints, bigger muscles, so they require more energy to actually activate. So the body likes to be efficient innately and tends to go to whatever requires the least amount of energy to get the job done. So anyway, with this client, the hip extensors in sagittal plane motions would fatigue, so the rest of her kinetic chain would compensate, particularly at first around the lumbosacral spinal extensors, where she would exhibit discomfort, not discomfort, but a tightening of those muscles during her bending motions, because in the sagittal plane the gluteals were fatiguing, so go higher up in the body in the spine, spinal extensors compensate, so she exhibited that. So when we were doing a deadlifting motion, or the deadlifts, and you ever notice when someone does a deadlift and you notice the bar tends to turn towards one side more than the other? So in her case, the bar was turning a little bit more to her right, so her pelvis was rotating more to the right. So to put this all together, her hip extensors were fatiguing in the sagittal plane, so her lower back muscles, spinal extensors, would compensate for that. And as they fatigued, or as they've had enough, the gluteal muscles, it went back to them and they started to compensate again, but not in the sagittal plane because they're fatigued. They started to compensate in the transverse plane, in the rotating or twisting plane. So that's why when she was doing a bending motion, such as a deadlift, her pelvis started to rotate to the right. So here's the thing. Her hips, due to that deconditioning of the gluteal muscles in one plane, cause this whole sequence of events where her body tries to be efficient and will compensate whenever it can with whatever demands that are placed upon it. So if you bring this discovery that we had into her daily activities, well, if those muscles, the hip extensors, are fatigued in one plane and it causes compensation in other muscles in the same sagittal plane, and then eventually in other muscles, or the same muscles in other movement planes, well, in her daily life, in a nutshell, her lower body, her lower extremities would be rotating or twisting towards her right, and then there's a counter compensation or counter rotation of her upper body to her left. So in effect, she was like, if you have a shirt and you twist up that shirt and you keep on twisting and twisting and twisting, where one part goes one way and the other part goes the other way, that's a lot of stagnation that's created. That's a lot of tightness, a lot of constriction, a lot of lack of flow, let's say, because of that torquing of her body on a more macrocosmic scale. So when you look at that physically, and this being all on her left side of her body, which is also part of that yin side of our body, part of that nurturing receptive side, and her symptoms were originating from the hip origin. This is a classic case metaphysically of someone who was having issues with her stability in being openly receptive. So this client also had some spiritual issues we've been working on. And when I say spiritual, I don't mean religious. I mean finding meaning in your life, getting the point, understanding the bigger picture. That's what I mean by being spiritual. Well, when you have physical symptoms and they've been hanging around and you've been addressing them, going to the proper appropriate specialist, but you still have these symptoms, just for once consider that you might be missing some meaning, some lesson to be learned. This is an opportunity for you, rather than it being, oh, I'm a victim, I have an injury, oh, poor woe is me. No, this is an opportunity, a golden opportunity for you to learn something about who you are, and more importantly, to learn more about your soul spiritual natures. So with this client, it was pretty evident, because we reached a point in her spiritual situation, because we were working with that, where she was more opening up to her relationships between her mind, ego, physical self, and her soul, spiritual, higher selves. So now her body was more openly receptive to learning new movement patterns and motor programs, because spiritually she also opened up or had some breakthroughs. So think about how many clients or patients where you try to biomechanically try to correct this imbalance and you try to make it more appropriate or more proper for that person's function, and you've done everything you logically and rationally can, but yet that person still has a way of going out of their adjustments or going out of their proper alignments. Well, maybe it's time to address some of the bigger questions, the deeper questions with meaning. So I want to leave you on that thought, and I want to thank you again today for listening or watching this video. Until the next time, this is Michael Hoxton from HoxtonHealth.com. Have a wonderful day.